Thank you for that great discussion, Nadeem. Thanks for bringing mental health to this stage. This is where it sort of begins, right? Here at the UN General Assembly, we get issues on the agenda and we look forward 2 or 3 years and we say, how did that ever happen? How did we end up with a high-level meeting? How did we end up with an agreement? And this is where it starts. So thank you for being a part of it. It's great to be back up here on stage. We are now, for those following online, doing days of programming here during the UN General Assembly. And we're touching on lots of really important, timely topics. But we want to take a moment to just step back a little bit because I've got with me Global Health's power couple. I think some of you know them. Chikwe and Vivianne Ihekweazu have written a book. And we want to talk about this because it's a reflection on their experiences personally, but also, I think, on a moment in global health. As I say, we focus on issues often, but this is a book that talks about institutions. And what does it actually take to build an institution? And it peels back the curtain a little and gives you the real human story. So first of all, it's great to have the two of you here. Thank you for writing this book. Thank you for coming and bringing it to our stage.
Thanks, Raj.
Thank you. It's great to be here.
I think most people here know you, but Chikwe is the Assistant Director General at the World Health Organization. Vivianne is the Managing Director at Nigeria Health Watch. So the two of you are working every day on pandemic preparedness and emergencies and health system strengthening. And you went through your own kind of crucible moment and you put it down in this book, An Imperfect Storm, because you were leading the Nigeria CDC at the moment that COVID hit. And you say the story in the book, Chikwe, but maybe we can just start with this. You were together with family in the village, right? You weren't in Abuja, but you were out in the village and you got some news. Tell us about it.
Yeah, thanks, Raj. Thanks for having us on your program. In Nigeria, there's a tradition that most people go back to their villages over Christmas and get out of the cities and go to reflect. And, leading the Nigeria Center for Disease Control, Nigeria, 200 million people, inevitably there's always something happening. And like I write in the book, the worst thing imaginable is my minister to hear that something has happened somewhere in Nigeria relating to an outbreak or something before I did. So I never wanted that to happen. So I had to stay in touch with my team, and we had a way of communicating and staying in touch. So, end of December, this news started trickling in, early January, and, scary moment. Somehow I've been, one way or the other, my career started during the emergence of HIV. I was around for the early SARS, early in my career, H5N1, H1N1, Ebola. I was in West Africa and Liberia. So the instinct of when something is beginning to happen is there. I didn't quite know what it was at the time, but I just knew something was about to take off.
Yeah, you write about how you're just kind of scrolling through the phone and you see a case, and you think, not in Nigeria, elsewhere, but you see a case, and it sparks your interest. You remember those days, those moments, Vivianne. What was it like for you? What do you remember from that period?
I think like many people, early 2020, we just started hearing trickles of news about cases in Wuhan at that time. And then very slowly, the news almost gathered momentum, and it was something we had never really seen before. And then we started hearing about airports being closed and traffic between, like I remember the UK and China, they closed they weren't allowed for passengers to come in. And we'd never seen that before. And at that moment, I think, I felt something different is happening here. And there was increased anxiety as things were unfolding. And I think the 24-hour news cycle made that even worse because you literally were seeing people, as many of you probably remember, in hospital beds and not knowing where or when this would end and what that would mean for everybody's individual country. So that was quite frightening at the beginning.
Chikwe, the Nigeria CDC at the time wasn't yet even authorized by law, right? It was like an initiative within the Ministry of Health when you joined. And then it was, I think in 2018, President Buhari signed it. So it was really nascent. I mean, how many people were working there? What was it like to try to lead this very nascent early institution at a moment of such crisis?
Raj, I would almost flip your question, and what I wake up now thinking is, what if we didn't have an NCDC in 2020? Because almost, it was the 3-4 years between 2016 and 2020 that we built up. We built the first national reference lab, built a lab network across the country, recruited staff, trained them, set up a surveillance infrastructure, digitalized our surveillance system, and this was just part of institutional building. And you work in development. The one thing that is very hard to get money for is to build institutions. Everybody wants to fund you to deliver vaccines, put people on ARVs, the things you do. But who does it? How to build the HR infrastructure, the people, the financing, the management? No one wants to fund that business. So it was a hard grind, and I'm happy it paid off. That at least we ended up in 2020 responding to an outbreak and coming out of it with our dignity intact. And if you remember the conversations early 2020, people said this continent will go down. This was the common narrative. This was the received wisdom. And so we stood up, we stood firm, we led a response. Yes, there are discussions, and those are important discussions on why and how, and we have to go into that. But at least we did not disgrace ourselves. And coming out of a country like Nigeria, where the negative narrative we have to live with every day, I'm proud that at least this book ultimately is a positive story of what is possible in a country that is, we're challenged with the single story that tries to define us, and we have to.
It is a positive story, but you don't sugarcoat the challenges in the book, which I appreciate. And maybe you can talk a little bit about those challenges. How every country was hit differently by COVID. What was it like in Nigeria?
I think, Nigeria, like as Chikwe mentioned, the assumption was that many people would be dying on the street. And, looking at the health infrastructure, that's the starting point, because any response has to be built on a resilient health system. And we already knew that our health system, as it was in 2020, was very underfunded. We already know our health outcomes. You look at maternal mortality, infant mortality, all of those things are not great. So that was on the backbone of this response. So the health system that was going to help respond to the pandemic was a problem. And then we also look at the income, how people earn their income. At the very early stage, there were lockdowns, so people were not able to earn a living. In many countries, there were support systems, social services in the UK, in the US, that supported people. But in Nigeria, many people earn a living day to day. So that was a real challenge. And looking back, there was obviously a big conflict between, do we let people stay at home, but then they're not earning a living? But then there were, as you will see in the book, there were responses to that, and that was led by the private sector. So yes, there were definitely those anxieties, but then the response, I think, showed us as a country what we can achieve when we come and work together.
What did you learn, Chikwe, about the health infrastructure in the country under that level of strain? We're already without a pandemic, as you say, that it's insufficient. What did you learn about it?
I think there are many lessons. And to me, the biggest lesson is we have to keep building. We can't sit back and celebrate our success, if you can call it that. We have to keep building. At the beginning of the pandemic, I counted the number of intensive care beds in the public sector in Nigeria. There were 200 for a country of 200 million. So I knew immediately that, we would be stretched. And then we pushed, and we built up a lab infrastructure and all those things. The challenge for us, and it's the same for every developing country, because there are competing needs for resources every single day. And it's very hard to keep health on top of the development agenda. How do we keep a focus of our leaders on healthcare, and how do we make health bring political capital to leaders? Very hard in our context where they have to show success very quickly in a 4-year election cycle.
I remember speaking with a Nigerian leader who, is a wealthy person, has a lot of opportunities, and he told me right after the pandemic, really the COVID pandemic changed the perspective of leaders in the country, because he said, we always thought we could just get on a plane and go somewhere else to get our health care. And then he said, I realized personally, me and my family, we couldn't go anywhere. And if we had a problem, we had to rely on the same healthcare system
Absolutely.
that 200 million other Nigerians rely on. And was that really a shift in the mindset? What do you think, Vivian?
I mean, one of the things many people in Nigeria remember is one thing that was quoted by the Secretary to Government of the Federation, who mentioned until COVID-19, he didn't realize how bad our health system was. And then the reality is that, yes, our political leaders, because they've never been really dependent, unfortunately, on our own health system, they've never had to think about accessing it. When they're ill, many of them, when they have the opportunity to, will travel abroad. But suddenly, with borders shut, there was no going anywhere. There's no air vacuuming anyone anywhere, and they had to be reliant on the same health system. And behind that, there was the hope for all Nigerians that this would teach them how, we always say health has to be a political priority. We really hope that would change their mindset. Just to say we're still pushing on that. But I think somehow health has been slightly elevated in Nigeria. It's given a lot more priority, but not as much as we wanted to. Yeah,
but there's also some good news stories out of that. The private sector has really evolved. So a lot of Nigerian doctors in diaspora have come back and set up high-end hospitals. So it doesn't solve the population level access for sure, but renal centers, private sector hospitals doing renal transplants in Abuja, in Lagos. Because it's not just at that level, it's not just the cost and equipment and expertise required for the surgery. It's all the social infrastructure around patients when they need prolonged care. So even if you can go to Egypt or India or the US to get the clinical care, Nigeria offers, you lose out on the social infrastructure. And that social infrastructure of people is probably our biggest strength. And you see many stories about incredible people in this book. I feel what we did in this book is really curate stories of incredible Nigerians that did a lot of work.
Some of whom lost their lives in this fight, right? This was not an easy situation for the leaders who are at the front lines.
No. And, the young man I wrote about who unfortunately passed away on returning from a trip where we'd gone to distribute lab equipment in the country, and I write in the book about having to go down to Owerri to tell his parents after the incident that, listen, we lost this guy, and how hard it was. But that's the responsibility, when you lead any institution in many of our countries, right? Not to say that leadership is any easier here, but at least I hope you can focus on leading Devex and not worry about whether your electricity is working, your light is working, whether, so when you are leading an organization in a country like ours, your mother, father, teacher, philosopher, psychologist, and in your spare time, you actually lead the organization.
It is a tough environment to operate in. And listen, one little vignette in the book that just sticks out to me is how, when you started leading the Nigeria CDC, you couldn't even get Twitter to respond to you to verify your official account. And, finally, after this pandemic, Nigeria CDC was recognized, you're able to do that. And it's maybe a small vignette, but it kind of shows how you matured this institution. And I think, as I recommend to all of you to get this book and to read this book, this is my copy with their autograph, so you're not taking it from me. That I think it outlines just how hard it is to build an institution, but that how important it ultimately is to the global health community. And this is where we have to focus our energies and our efforts. So it's been fantastic to get to spend some time with you, but I want to hear your last thought, Vivian.
I think our last thought, when people read the book, is we wrote it from a perspective, yes, of the clinical response, but also to humanize the response. Because for many people in this room, everybody will remember what you went through. And it was for us also quite cathartic to put it down in a book. And also to make sure that our narrative from the African continent is also told and shared. Thank you.
It's an accomplishment to write a book. It's a real accomplishment to write it as a couple. This is an amazing power.
And survive after it.
Yeah, you survived. Please join me in thanking Chikwe and Vivianne Ihekweazu.
Thank you, Raj. Thanks.